All right, so we were talking about the macrophage and the definition. So those monocytes which have gone into the tissue and are living there are called macrophages. So again, now let's talk about them a little bit, about their origin. So again, I'm following the topics here which are on this board. So the origin of the macrophage, where does that macrophage come from? So macrophage is of course a cell which is formed in the bone marrow. Now here is a very important thing. Please remember this clearly. Macrophages not only are formed in the bone marrow, macrophages live in the bone marrow as well. So the macrophages which are living in the bone marrow is a different thing. Macrophages which are formed in the bone marrow is a different thing. So plus, then there are macrophages which actually form bone cells as well. Osteoclasts are also macrophages. Again, I've said this before, I'll say it again. The people who are in research about these cells, their exposure to the knowledge is different from ours. So they know more, they have exposed to the cutting edge or the latest knowledges. And if you look at their thesis or the PhD thesis or papers, there are various school of thoughts. There are various experimentations out of which some scientists say that, well, an osteoclast is a macrophage. Some other scientists or researchers come up and they say, well, an osteoclast is not a macrophage, is a separate cell which is similar to a macrophage because of its way of functioning and because of its cluster designations. So again, over here we are talking about the undergrad and grad level medicine, and at our level this is fine to understand that a macrophage, an osteoclast is a macrophage, and we can be happy with that. So again, within the bone marrow, macrophages are formed from the, of course, myeloblast cells, which give rise to many type of various cells which are in the blood. One lineage is myeloblasts giving rise to the monocytes, not macrophages. Macrophage directly do not arise from bone marrow. We always end up having a monocyte. A monocyte, when it is formed, it comes out of the bone marrow into the blood. Inside the blood, so please note this, inside the blood, so let's say this is the bone marrow house, a monocyte, this is a monocyte. It's a young cell, it's sort of a happy cell, it is just having fun. I'm trying to make it nice and dandy. So this is a nice monocyte. Right, so this nice monocyte, I'll make it some shoes so it can walk. So this nice monocyte is coming out of the blood vessel, sorry, bone marrow. It's going to enter a blood vessel, and so it will become part of the blood. So here is the monocyte. That is why this system, the macrophage system, is called macrophage monocyte system, because both of those cells are actually same cell, their medium or their presence is different. So when the monocyte comes out of the bone marrow, goes into the blood, it is called monocyte. Now please remember this, do not forget this, remember this, please remember this. A monocyte which is present in the blood is not active. Compare this to the neutrophil. Neutrophil which is present in the blood is active. A neutrophil present in the blood can capture stuff which it think are pathogens and eat them and kill them. A monocyte is very limited, or it has a very negligible activity. So what is it doing? It just is wandering around. How long would it wander around? 10 to 20 hours. So a monocyte is going to wander around inside the blood, just going, having fun inside the whole body for 10 to 20 hours. After that time, this monocyte is going to get out and go into the tissue. Now the question is, so again, our theme of our studies is to clear our concepts. So sometimes students carry various confusions in their head and they just keep them even as doctors, and that as these are the concepts which cause problem when actual practical problems appear. A monocyte gets out into the tissue from the blood vessel. Good. How does it go out? Why would it go out? So remember, we've talked about it in the past for the neutrophil. If not, go back to the neutrophil lecture and read it. In the past, we've talked about it that the neutrophil will migrate from the blood vessel into the tissue after some chemotactic factors are present. Chemotactic factors, where do they come from? They normally come from the tissue if tissue is experiencing some damage. What are the chemotactic factors? Tissue breakdown products. Macrophages present in the tissue sending the chemotactic factors. Other cells present in the tissue sending the chemotactic factors. Endothelium of the cells which are present near the broken tissue sending the chemotactic. These are chemical factors which allow other cells to be brought into that area to cause inflammation and repair and healing. So the question is, will a macrophage get out, or will a monocyte get out of the blood vessel after a chemotactic factor is encountered? No and yes. Yes, if there are chemotactic factors present, if a tissue is damaged, if a virus or a bacteria is having fun here. So remember our little monster viruses and bacterias, they really love to have fun, right? So this guy is just jumping around. So why is it jumping around? Why is it having fun? Because this guy really thinks that he is having fun and is enjoying the life. So in that part, in its mission of enjoying the life inside our body, what is it going to do? It's going to be breaking up the tissue. Remember, the viruses get into the cell, they replicate in the cell, they break the cell, they come out, and of course the cell breaks down. Those breakup products are the chemotactic factors. So of course, if there is a tissue injury or if there is infection in the tissue, that would cause the chemotactic factors to be present. If that is the case, then a monocyte is going to leave the blood vascular system even if it is not 10 to 20 hours. It's natural. A monocyte finds out within 2 minutes of its entry into the blood system that, hey, I need to get out and fight with an infection. It will get out. So it is not necessary that a monocyte is given a ride for 10 to 20 hours inside our blood vascular system and it cannot get out meanwhile. No, it will get out. But, now this is important, but if there is no chemoattractant factor, if there is no chemotactic factor, even then a monocyte is going to exude or get out of the blood vascular system from 10 to 20 hours. That is what is important to keep in mind. So a monocyte is going to get out anyways. Most important thing for it to get out is going to be the chemotactic factors, infections, tissue breakdowns and so on, but it's going to get out 10 to 20 hours. Okay. So 10 to 20 hours monocyte is going to get out, or chemotactic factor is going to cause the monocyte to get out. And we have talked about how the diapedices occur, how the cells move from the blood vascular system into the tissue. I'm not going to repeat it. I did that in detail in the neutrophils. So go back to that lecture and check that out, how the diapedices occur, how the integrins and selectins, they stop the cell in the endothelium, and then how the cells is extravasated from the blood vessel into the tissue. Now, do you know this thing is a very important thing, very important thing. How far, so let's say there is some tissue breakdown here. How far the tissue breakdown product would attract the cells? And the cells are going to be neutrophils and monocytes. How far that attraction power is? Well, normally 100 micrometers. If a tissue is broken down, the tissue breakdown products are going to be present up to 100 micrometers. So that means if we have tissue damage in an area where a blood vessel is more than 100 micrometers away, that area is not going to get any attention from the cells, right? Right? Here's the funny thing. In our whole body, there is no tissue which does not have a blood vessel, a capillary, which is more than 50 micrometer away from it. There is no cell in our whole body which does not have a blood vessel within 50 micrometers span or distance. So chemoattractant factors or chemotactic factors can go up to 100 micrometers, although the blood vessels are found within the 50 micrometers. So that means whenever a tissue damage would occur, whenever an infection would occur, this will be for sure that the chemotactic factors will be going out into the blood vessel, and monocyte and neutrophils will be coming in.